I want to bring in Wish TV medical expert and former Surgeon General, Dr. Jerome Adams now. Doc Adams, always good to see you. Let's start with those new isolation guidelines. You've been pretty active on social media over the past 24 hours. You disagree with the new CDC recommendations. Why?
Well, I disagree because every doctor, every health professional I've talked to, including people within the CDC, say that if it were their family, they wouldn't end isolation until they had a negative antigen test. That is really what the science tells us is the best way to protect ourselves. Unfortunately, we know that there's not enough tests out there to make that possible. And so what you got was a political compromise, quite frankly, by the White House and the CDC saying we're going to end isolation in a way that protects the majority of people. But remember, majority can be 51%, it can be 55%. The CDC didn't share that data. They just said the majority of people will be protected if we end isolation in 5 days. But the real way to end to protect people is to make sure you have a negative antigen test before you go out in public.
So compare this decision to the one this summer where the CDC said vaccinated people can stop wearing masks.
Well, they said vaccinated people could stop wearing masks. What most of America heard was we are done with masks. I'm worried now that they're saying that people who have isolated for 5 days can end isolation. But what most of America will hear is that, hey, isolation's done for everybody. It doesn't matter if you've got symptoms or not. It doesn't matter if you wear a mask, because that guidance also says that for the second 5 days, you should be wearing a mask around everyone else. And we haven't had a great mask compliance thus far, so I don't have a whole lot of confidence that people are going to wear a mask after they end isolation.
So in your opinion, is this decision to reduce to 5 days for isolation driven by science or by trying to make it easier for people to return to work?
Well, it's certainly been driven by the workforce. It was spurred, or at least it seems like it was spurred by the airline CEOs reaching out openly to the CDC and saying, we need this. The healthcare industry certainly is under stress, and I understand that. But here's the problem with the logic that's been articulated so far. Yes, you may get someone who tested positive back to work sooner, but if even a small percentage of those folks are able to spread and they spread it to more people, then you're going to have more people unnecessarily having to leave work. So one may cancel out the other. My recommendation to people is if you can get your hands on an antigen test, and they are floating around out there, and hopefully more will come in the new year, as the president has promised, then use an antigen test before you break isolation.
I want to go back to masks for a second here. With the Omicron variant, do the cloth masks help at all? Or is it time to kind of retire those and use the medical masks that we see, or the N95s?
Well, two separate questions there. Number one, every barrier that you have provides an incremental advantage. I'm talking right now, there may be droplets coming out of my mouth. A cloth mask is better than nothing if you're speaking closely with someone. But with Omicron, it's so much more contagious that you really do want an N95, a KN95, a KF94, one of those higher quality masks to give you the best protection. And you can get them from Amazon, you can get them from Home Depot. They're actually pretty easy to get in most places now. And I have gotten them for my entire family, even smaller ones for my kids, especially if you're going to be traveling in the airport or in public. Try to use a higher quality mask.
Dr. Adams, let's turn to testing, and I appreciate you taking some time this afternoon. Specifically, though, those at-home tests, we're seeing more than a few people get false negatives, as you very well know, because they're only swabbing in the nose, right?
Exactly. Two reasons people are getting false negatives early on. Omicron actually replicates so quickly that I could get a negative test on an antigen test at 9 in the morning, and it could be positive by 9 at night. So what people actually recommend is that you actually use 2 of those tests. And that's actually what's always been recommended for the antigen test, that you do it one day and you do another one on the second day to make sure you aren't missing that window. That's number one. Number two, Omicron, as we've seen so far, replicates a whole lot more in the throat than what the earlier strains do. Delta tends to be in the nose. And so it's much better to swab the throat and then swab your nares if you want to catch Omicron.
One final question before we let you go. Governor Eric Holcomb and Dr. Box scheduled to give a news conference tomorrow to talk about Indiana's COVID response. What do you want to hear from them?
Well, Mary Gillis, Wish TV's own Mary Gillis, said this morning that Indiana ranked at the bottom of all states in terms of our COVID response thus far. 48th in vaccination rates, 49th in positive testing rate, 46th in hospitalization rate, 45th in death rate. And I'm hoping that Governor Holcomb and Dr. Box will address what they're going to do going into the new year to make testing more available and to get more people vaccinated and boosted, and to continue the outreach that's going to be necessary to defeat the virus. And Phil, I'm hoping they'll announce me as the starting quarterback for the Colts, because I know they need someone.
Yeah, we could definitely use somebody, right? Hey, Wish TV medical expert and former Surgeon General Dr. Jerome Adams, Happy New Year to you, sir, and your family. Stay safe.
Same to you, Phil. Take care.
Thank you.